Thank you. So as Anthony mentioned, I'm going to speak a little bit about some of the work we're doing in applying a systems approach to engineering healthcare. This will lead into our breakout session related to technology supporting precision and value. The discussion around value necessarily centers around topics such as outcomes and cost and several other parameters that were discussed throughout the day. And implicit in that pursuit of value is the desire to develop solutions that are broadly disseminated, sustainable, and highly reliable. Not solutions that tend to be the result of isolated solo champions or serendipity, and not the result of just plain good fortune. We're in pursuit of solutions that are robust and sustainable and disseminatable to a number of different care settings. So we want to, in pursuit of that high reliability kind of vision, we're seeking to implement solutions that are designed from a holistic perspective. That is, with all the necessary stakeholders involved, and developing solutions that are problem focused, not technology driven, not the proverbial hammer looking for a nail. So that characteristic of that systems approach is pervasive through much of the work that we do, and I was going to highlight a few projects that we are involved in from the perspective of defining a challenge, defining some potential solutions, and then associated with the various projects we're involved with. And these are all may seem seemingly disparate projects, but they're all designed collectively to improve outcomes and safety and affordability, efficiency, and access to care. The sampling of challenges or problem-focused areas that we're tackling that we'll describe today are funded through a 4-year grant from HRQ. The systems approach that I mentioned earlier is a term that gets used often in different settings and means different things to many different people. So I thought we'd start with a graphic illustration, a bit of a description of where we're coming from when we talk about a systems approach. The graphic and the illustration in the upper left-hand corner drives home the backdrop for our work, that is this systems thinking component of the systems approach. In the systems thinking vein, we approach our projects recognizing the causal interrelationships among workflow, culture, and technology, wrapped in a layer of learning and accountability. You know, often, as engineers, we're brought into the conversation to develop solutions, and we're asked to provide this new app or this new device, and that will solve all the problems. But as systems thinkers, we need to step back and say, well, wait a minute, let's have a conversation a bit about the bigger picture. Let's look at the forest before we dive in and start building a new tree. And so we start with the need for scalability and reproducibility and high reliability, and so that becomes baked into the design of whatever solution we may develop down the road as the conversation progresses. The companion to this systems thinking component of the systems approach is the systems engineering life cycle, which is depicted in this V diagram. There are other illustrations or versions of this that could be depicted as a spiral, but essentially it starts in the upper left-hand corner where we conceive of a problem that needs to be solved, understand the problem space as thoroughly as possible, and then also drill into measurement of key performance parameters that will ultimately have to realize, the system will ultimately have to perform in the future. After understanding the problem space, we decompose it and understand more of the solution space, and ultimately, across the bottom, implementing a potential solution, integrating it into a holistic solution, and then fielding it and assessing the system's value. As systems engineers working with clinicians, patient and family representatives, and a number of other different stakeholders, we need to make sure that we don't jump to the solution step without carefully considering the goals of the system up front. We need to emphasize dwelling a good bit of time on understanding the stakeholders' requirements and the important metrics that are necessary to determine whether the solution truly ultimately meets the stakeholders' requirements. Across the bottom, the banner there emphasizes the importance of the stakeholder from start to finish through an endeavor like this, and as well as the involvement of transdisciplinary teams. Each of the elements that you see described on the V diagram have associated with it a set of formal processes and procedures, but one of the key tenets of systems engineering is the need to tailor, and that not every project is the same. And accordingly, as we work through our projects, we're dwelling on each of these areas with respect to the necessary needs of the individual project. So to highlight a few of the projects we're working on, in one of our HRQ projects, we're building on the simplified concept of operations model we developed during an earlier project called Emerge. And in this project under the HRQ grant, we're refining this concept of operations and codifying a process to apply a systems approach to healthcare. We're using tools such as rapid concept exploration, quality functional deployment, and simulation events to understand the current state, to explore what works well and where gaps exist, and ultimately producing a roadmap where we can guide the pursuit of a highly reliable health system. I mentioned quality functional deployment a moment ago, or QFD. That's a tool that we borrowed, the system engineering field borrowed from the automotive industry to methodically and systematically capture the needs of requirements of the stakeholders and prioritize them accordingly. In a second project associated with the HRQ project, we're investigating challenges related to productivity. In this case, we're looking at capitalizing on interoperability to improve medication administration. Specifically, our case study is focused on insulin delivery, insulin administration. That involves a multi-step process that includes hand calculations, and it also includes a two-person double check meant to be a fail-safe means for ensuring that medication is delivered correctly. That second person check, however, isn't a foolproof method, and it's time-consuming and and error-producing. In the time-consuming vein, the primary nurse who needs to administer the insulin in this case has to locate a second nurse who has to come, separate from what they were doing, come over and verify the dosing calculations and the pump settings. And this second nurse involvement is, again, meant to be a fail-safe method of making sure the drug is administered properly, but it can also induce errors when that secondary nurse goes back to what they were primarily doing and having to re-engage the tasks that they were involved in before. So in this project, through a connection between the medical record and the infusion pump, we're creating an automated dosing calculator that can be used in place of that second person double check. And we're trialing the improvements in productivity and safety that this type of automation would afford. And this could be a model for other kinds of automation tools to be integrated into the clinical setting. Our third project that I was going to highlight as part of our HRQ project is focused on the unit level risk to harm, or risk that may induce harm. Whereas previously, most of our work we've been working to date has kind of been at the patient level. This is more at the unit level. What we're striving for here is to develop a real-time dashboard of unit level risk by creating a barometer of stress on the unit. So the causal loop model that you see here is the basis for our unit level stress model. And through a collaboration with the Carey School, we're applying machine learning to the data items you see described here. And we aim to see if this model is indeed a valid way of measuring stress and its relationship to preventable harm. That notion of validating performance is really important, and in kind of its transition later on to our breakout session a little bit later on, we wanted to emphasize that as we're trying to think about problems to solve, and as David Newman-Toker mentioned, costly, common, and catastrophic problems are a good model or a lens to look for challenges to solve. We want to emphasize the importance of focusing on measuring performance to ensure that we're not getting trapped in a reductionist approach to solving the problems that we've set out to address. So I think with that, I hand it over to Adam, who's going to speak a little bit more to other aspects of our collaboration that we're involved with together.